Hey everyone, and welcome back to the channel. Today we're talking about something that could literally change your health game after 60, and it's probably not what you think. You see, most people believe that more vitamins equals better health, especially as we age. But here's the truth. Some supplements you're taking right now might actually be doing more harm than good, while others you're probably missing out on could be absolute game changers for your energy, bone health, and mental clarity. So in this video, I'm breaking down the 3 supplements you should seriously consider cutting back on, and the 3 that deserve a permanent spot in your daily routine. And stick around until the end because I'll share the number 1 mistake people make when taking supplements that completely wastes their money. Let's dive in. Section 1. Supplements to cut down. The first supplement is excess calcium. Now, before you click away thinking I've lost my mind, hear me out. We've been told for decades that calcium supplements are essential for strong bones, especially for seniors. But recent research has thrown a major curveball into this advice. Here's what's happening. If you're already getting adequate calcium from your diet through dairy, leafy greens, and fortified foods, adding a high-dose calcium supplement might actually increase your risk of heart problems and kidney stones. A major study in the Journal of the American Heart Association found that excessive calcium supplementation was associated with increased arterial calcification. The key word here is excessive. Most seniors are actually getting enough calcium from food, but they're still popping 1,000 to 1,200 milligrams supplements daily. What you really need to focus on is vitamin D and vitamin K2, which help your body actually use the calcium properly instead of depositing it in your arteries. Action step: talk to your doctor about getting your calcium levels tested. You might be able to cut back significantly or eliminate your calcium supplement altogether if your diet is already calcium-rich. Supplement to cut down. Number 2, iron, unless deficient. This one surprises a lot of people. Unless you've been diagnosed with iron deficiency anemia, taking iron supplements after 60 can actually be problematic. Here's why. Unlike many nutrients, our bodies don't have a good way to get rid of excess iron. As we age, especially for men and postmenopausal women, iron tends to accumulate in our organs. This excess iron can generate free radicals, potentially contributing to oxidative stress, which is linked to everything from heart disease to cognitive decline. A study published in the Journal of Alzheimer's Disease even found connections between excess iron accumulation in the brain and neurodegenerative conditions. Most seniors who eat a reasonably varied diet get plenty of iron from food sources like meat, beans, and fortified cereals. The exception? If you have confirmed iron deficiency or certain medical conditions. But that's something only blood work and your doctor can determine. Action step: get your ferritin and iron levels checked. If they're normal or high, skip the multivitamin with iron or switch to an iron-free formula. Supplement to cut down. Number 3, vitamin A, high doses. Now, vitamin A is essential for vision, immune function, and skin health, no question about it. But the problem is vitamin A is fat-soluble, meaning it builds up in your body over time rather than being flushed out like vitamin C. For seniors, this is particularly important because as our liver function naturally declines with age, we process vitamin A more slowly. Taking high-dose vitamin A supplements, especially the retinol form, can lead to toxicity, which manifests as liver problems, bone loss, and even increased fracture risk. Research in the Journal of Bone and Mineral Research found that excessive vitamin A intake was associated with decreased bone mineral density and increased hip fracture risk in older adults. The good news? You can easily get all the vitamin A you need from colorful fruits and vegetables, which contain beta-carotene, a vitamin A precursor that your body converts only as needed, making it much safer. Action step: check your multivitamin label. If it contains more than 3,000 IU of preformed vitamin A, retinol, consider switching to one with lower amounts or that uses beta-carotene instead. Section 2. Supplements to take daily. Now let's flip the script and talk about the 3 supplements that can be absolute powerhouses for seniors. Supplement to take. Number 1. Vitamin D3. This is non-negotiable for most seniors. Vitamin D3. This is arguably the most important supplement on this entire list. After 60, your skin becomes less efficient at producing vitamin D from sunlight. We're talking up to 75% less efficient. At the same time, Vitamin D deficiency is linked to everything from weak bones and falls to immune dysfunction, depression, and cognitive decline. The research is overwhelming. Adequate vitamin D levels are associated with better bone density, reduced fall risk, improved immune function, and even better mood. A meta-analysis in the BMJ found that vitamin D supplementation reduced the risk of acute respiratory infections, which is crucial for seniors. Most experts recommend 1,000 to 2,000 IU daily for seniors, though some may need more depending on their blood levels. The key is getting the D3 form, cholecalciferol, not D2, as it's more effective at raising blood levels. Action step: ask your doctor to check your vitamin D levels and recommend an appropriate dose. Take it with a meal containing fat for better absorption. Supplement to take number 2, vitamin B12. This one's critical because up to 20% of seniors are deficient, often without even knowing it. Here's the problem: as we age, our stomachs produce less acid, and we need stomach acid to properly absorb B12 from food. Additionally, many common medications like metformin for diabetes and proton pump inhibitors for acid reflux further block B12 absorption. B12 deficiency sneaks up on you. Early symptoms like fatigue, brain fog, and memory problems are often dismissed as just getting older, but they could actually be signs of B12 deficiency. Left untreated, it can lead to irreversible nerve damage and cognitive decline. The beauty of B12 supplementation is that it's incredibly safe, even at high doses, because it's water-soluble and your body simply excretes what it doesn't need. Action step: take 500 to 1,000 micrograms of B12 daily, preferably in methylcobalamin form, which is more readily absorbed. Look for sublingual tablets that dissolve under your tongue for even better absorption, bypassing the stomach issue altogether. Supplement to take number 3, omega-3 fatty acids. Omega-3 fatty acids, specifically EPA and DHA from fish oil or algae oil. These essential fats are absolute workhorses for senior health. They support heart health by reducing triglycerides and inflammation. They support brain function and may help slow cognitive decline. And they even help maintain eye health and reduce dry eye symptoms. The VITAL study, one of the largest supplement trials ever conducted, found that omega-3 supplementation reduced heart attack risk by 28%. Other research has shown benefits for everything from joint health to mood. The challenge is that most people don't eat enough fatty fish to get adequate omega-3s. You'd need to eat salmon or sardines 3 to 4 times per week to hit optimal levels. Action step: look for a high-quality fish oil or algae-based omega-3 supplement providing at least 1,000 milligrams of combined EPA and DHA daily. Choose brands that are third-party tested for purity and freshness. To conclude this, so there you have it, 3 supplements to seriously reconsider, and 3 that could be game changers for your health after 60. But here's that critical mistake I mentioned earlier: taking supplements without knowing your actual levels. Blood work is your secret weapon. It takes the guesswork out of supplementation and ensures you're not wasting money on things you don't need or, worse, potentially harming yourself. Before making any changes to your supplement routine, have a conversation with your healthcare provider. Get tested, review your medications, and create a personalized plan that works for your body. If you found this helpful, smash that like button and subscribe for more evidence-based health content. Drop a comment below and let me know. Were you surprised by any of these? What supplements are you currently taking? Thanks for watching, and I'll see you in the next one. Stay healthy out there. Disclaimer: this content is for educational and informational purposes only and is not intended as medical advice. Always consult with your healthcare provider before starting, stopping, or changing any supplement regimen, especially if you have existing health conditions or take medications.